Hi everyone, my name is Marissa Verratti, and for our educational infomercial, I decided to do my topic on health literacy. What is health literacy? Why it is important? The different organizations that sort of support this topic, and also some examples of ways that we can provide health literacy education towards our patients in the future, and so on and so forth. So let's start off with what is health literacy. And according to the CDC, health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions, whether this means to understand their post op directions or even just like whether or not they need to come in for a flu shot and just their basic understanding of health terms in that sort. So, why is health literacy an important topic in health research and in today's world? Is because health literacy is essential for people to successfully access healthcare that is available to them, whether that be going to get their flu shot or even like vaccinating their children, and the pros and cons of everything. A lot of the time, our doctors use big words that we do not understand, and health literacy is just how well you understand the information that is being given to you. And if someone with good health literacy, they can have more active roles in helping themselves. For example, going to get a mammogram because they understand that at Planned Parenthood you can go and get free mammograms. So this is actually a very big problem in the United States. According to the IOM, there's more than 90 million people that lack health literacy skills needed to understand and act on health information given to us. A lot of people don't know what they're reading or the information being given to them, so they don't even act on it. They just sort of ignore it, and that's why we're seeing a lot of different epidemics like flus and colds around the United States. The people that are most problematic with health literacy would be the elderly who are hard of hearing, don't understand new and upcoming things, and also the chronically ill that just are very sick. The next thing I would like to talk about is the organizations that actually advocate towards health literacy and try to make health literacy more important in the United States, and that would be the Agency for Healthcare Research and Quality, Health Literacy, National Institutions of Health Clear Communications. They just state ways that you can communicate clearly with your patients as a healthcare provider. And also the Roundtable of Health Literacy. They bring together experts in the field, whether it be doctors, researchers, nurses, public health advocates, anyone like that, and they bring them together to look for ways that they can improve health literacy around the United States. The last thing I would like to talk about is 8 ways to improve health literacy. As I was doing my research on health literacy, I came upon the Institute of Healthcare, and the executive director actually stated on their website that he believes that healthcare providers, anyone providing health care information, should follow these 8 steps to ensure that their patients actually understand what was given to them and they're just not shaking their head to sort of get out of the appointment or speed along the process. And the 8 ways to improve health literacy. So the first one is to ask open-ended questions, assess the patient's understanding of what they are saying. So basically, just ask questions that aren't so closed-minded and that you're able to sort of explain what's going on. Also, number 2 would be repeat what the patient is saying. So just basically repeat back to the patient what the patient said, so they know that you understood them, and if they have any questions about what they said, they have time to ask you. 3 would be teaching the patient how to use a device. So say they were given an inhaler, make sure that they know exactly how to use it, explain the directions on pill bottles, different things of that sort. Number 4 would be make sure you read the patient's labels, which I said, along with the device, like reading them their post-op information, their write-up from their appointment, certain things like that that could have more higher educated terms that the normal person that didn't go to schooling for medicine wouldn't understand. And then that leads me into number 5, which is use simple language. So when you are explaining this paperwork or their pill bottles, make sure that you use language that they clearly understand, and kind of make sure it's just lower educated terms. Number 6 would be to speak slowly. Sometimes doctors, healthcare people, when you know your subject that you're talking about, or the topic, or the illness that this person has, you've said it so many times, you tend to kind of skip details. Just because the doctor knows it doesn't mean that the patient knows exactly what's going on, so make sure you speak slowly. 7, use graphics rather than long paragraphs of instructions. So a lot of the times, a nice little graph with a picture of how to intake, short bullet points of when to intake your pills, things like that. And 8 would be to provide information at an appropriate grade level. So say the way you would talk to someone that is studying medicine would be a lot different than someone that didn't complete high school. So just really look at the person and the demographics of what you're dealing with. Health literacy is a problem in the United States, and yeah, so thank you for listening.